I want you to feel interactive. You know, I'll ask some questions. My goal is for you tonight to leave here maybe a little more educated than when you came. That'd be a fair goal. Have some fun doing it. Learn some things. See if you feel that this is something that makes sense for you in your life or people that you may know, for example. What's interesting about my background is that when I first got into medicine, it's been 30 years, and it's crazy, but can any of you say that you've done something for 30 years? Is there anybody in the room? There's a couple of us, yeah. Wow. I mean, all the same field. You're not old enough to have done something for 30 years.
Yes, I am.
All right, well, you don't look it.
30 years.
Okay,
We're
that
still
counts.
nurses.
All right, you don't look old enough, but I believe you.
Okay.
Okay, so, all right, give them all the badge. Okay. And at the time, I was repaying school loans, and I was also serving my country. And so if I shout out to any fellow veterans, you know, that are in the audience, hey, so we all have DD Form 214s, don't we? And only those of us who know what they are have one, or have one, know what they are. So at the time, I was working on the base and taking care of pilots and flying and all that kind of stuff. But on the weekend, I had to pay back my school loans, so I'd moonlight in the ER. So if any of you can identify with school loans, I had lots of them. And so what I saw during the weekend was all the stuff you see in the ER, right? Everything that lands in the emergency room, and you all know what it is: heart attacks, strokes, car crashes, runny-nosed babies at 2 a.m., delivering babies, and just, you know, fractured femurs, all that kind of stuff. And then during the week, I have super healthy people that I was flying with, two big different parts of medicine. And so on the weekend, I would garner all these stories to teach the pilots during the week. Hey, let me tell you what I saw, and you don't want to have this happen to you, in an effort to open their eyes toward prevention. And so what I learned after doing this for a number of years is two big differences in medicine, and that is we don't have a lot of good solutions for chronic illnesses in America. So what are chronic illnesses? Blood pressure, cholesterol, diabetes, osteoporosis, certain cancers, you know, things you kind of, autoimmune disease, you kind of got to live with them for years, so you manage them. And rarely in there do we have solutions to deal with the root cause. And so I began on a quest to say, hey, I'm taught to fix and cure. So any of you that are here, you know, that are medical, we're all taught to fix and cure. Our system teaches that. I'm not throwing rocks at our system, but it doesn't teach us how to maybe peel back the layers of the onion a little bit and look for the root cause of the problem. So I started doing that about 15, 20 years ago, and if you can identify that and focus on the root cause and effectively deal with that, now you're reducing or eliminating the medicines. You're reducing or eliminating the needs for the fixes and cures. So it's a focus on healing more than it is on fixing and curing. Okay, are you following me philosophically? So I think the greatest medicine of all is to teach people how to not need it or reduce their dependence on it or their need for it in the first place. So that's what that's going to be the theme. And to do that, we're going to focus on hormones. Okay, so basically this is what we're going to talk about. So I was in the military, and in the military it says, you know, to give a briefing, you tell them what you're going to tell them, and then you tell them, and then you tell them what you told them. Okay, so we're going to follow that format. Easy to follow, right? So we're going to talk about what are hormones, what are the differences in synthetics and bioidentical or human identical, what are the different choices, how can they help men and women, what are these risks that people have heard of, hey, I heard you could get, you know, certain things, and then are you a candidate? That's basically the format we're going to follow, okay? That being said, start with the beginning. So here's us, here's me. I went into medicine to do health care, but somewhere along the line, I got really, maybe my efforts and my focus got directed toward disease management. I didn't go in to manage disease, I went in to give people health care, but the system teaches me how to manage diseases. And so after being in family practice for, 10 years, I'm saying, man, my patients weren't really getting better, and I was adding to their medicines, not reducing them. And that's when I said there's got to be a better way, and that's when we started focusing on the root cause. Okay, so here's conventional medicine, right? It says, hey, from 0 to 10 to 20 years of age, you're on the rise, your reserve capacity is good, and then after 20, 30, everything kind of starts downhill a little bit. We start having more problems until the later years of life, when now we got a lot of diseases, and our system teaches how we can help people live longer, but nowhere in there does it teach us how to have a better quality of life. So I don't know about you, but I wouldn't, if I can live to be 90 and be productive and out and about, or 100 or more, great. But who wants to be 80 or 90 and then curled up in a ball in a bed somewhere? See, those people don't have quality, and they don't want that if you talk to them. So our system doesn't teach us how to give us quality life. It says we can make you live longer, but now you live longer, so now you have your fractured hip, your pneumonia, your heart disease, your diabetes, all that, and then your quality of life kind of sucks. So anyhow, that's conventional medicine. So there was me. This is the cliff. I'm the guy at the bottom of the cliff catching the patients as they fell off the cliff into my emergency room. I would patch them up. I'd either treat them and street them, or I'd treat them and put them in the hospital. But my inbox was never empty, and I really wasn't feeling like I was making a difference. So then, once I changed focus, I said primary prevention. We're going to put up a guardrail. We're going to show them how to drive by the ER rather than into the ER. You see the difference? So Osler, anybody that's in medicine has heard of William Osler. He says the person who takes medicine must recover twice. First from the disease, the second from the medication itself. Okay, because it has side effects. And this challenge was given to us 2,600 years ago, over 4,000 years ago. Superior doctors prevent the disease. Mediocre doctors treat disease before it's evident. Inferior doctors treat full-blown disease. And that was, I say that a little tongue-in-cheek because when I'm in the ER, I'm the guy that's treating the full-blown disease, but I never had the chance to see them before. It wasn't my fault. So now that I know that, hey, you look at it with a lens of what's going on inside now that we can begin to alter the trajectory of the course of where they're currently headed. So here's our focus now. Regenerative, preventive medicine. There's that curve, 10 to 20. But then as it starts down, we focus on vitality, quality of life. And then when we're living longer, we retain that quality. Okay? So that's where we're going to spend our time and our efforts. So do you want lifespan or do you want health span? See, these two people are the same age. And it kind of exemplifies what we talk about. I don't know you, but I'd rather be running those hurdles over there because I'm able to, right? So it's a functional medicine approach. This is a little complex looking, but if you look at these little blue circles, the first one says in the center of the core there, it says depression. Well, if the person is having symptoms of sadness, not sleeping, they're tearful, and some depression, our conventional medicine says, well, here you go. We need to give you some antidepressant medication. Okay, well, that's fine, but that's not the root cause of the problem. When I see that, which I've done, and I still use it temporarily as a bridge, but really, when that person has it, do they have a Prozac deficiency in their body? Do they have a Wellbutrin or a Zoloft or a sertraline or a citalopram deficiency? Are you following me? That we're clearing that deficiency and that's why they're depressed? No. There may be hormonal, maybe D, maybe their thyroid, it might be pre-diabetic, there might be other things fueling it temporarily. That's what we want to address. That's the functional medicine approach. So here's what you need to know. One of the most important slides, not all hormone therapies are created equal. That is absolutely key, okay? Number two, it is not a one-size-fits-all. It's not a cookie-cutter approach. It has to be customized. Customization, not generalization. Right? Everybody's different, and this therapy that we're going to teach you is based on it's released based on cardiac output, but it's figured out based on GFR, which means kidney function, activity level, weight, and the levels of blood within your system. Because everybody in this room and on the video is very unique. So we have to make it unique and specialized to them. Finally, we want to optimize, not just normalize. What do I mean by that? So if anybody that's ever had a blood test done, you notice that you get an answer, and then you get like a result, and then it's compared to a reference range. Okay, sometimes they call that normal range. So here's what happens. The lab draws the blood. Let's say it services this sector of the state, and your doctor orders tests, and you have a blood panel, and every little test has a result, and it's put in a reference range, okay? That reference range is formed based on an averaging of the general population. It's a 95% confidence interval. Everybody falls under a bell-shaped curve for that. As it relates to hormones, the younger people are more on the right side of the curve. The older folks are more on the left side of the curve. So what happens is, I think we all reach a season of our life where we're saying, I don't feel myself anymore. How come I'm tired all the time? Why do I have dry skin, brittle nails, foggy memory, constipation, low energy, elevated cholesterol, brain fog, cold hands and feet, poor libido, I'm gaining weight, my sleep sucks, my joint aches, I have hot flashes, night sweats. I'll keep going if you want, but usually you're like, okay, I know what you're talking about, and people don't know what's going on. And so they get confused, and so they just Google it. That's what everybody does these days. They just Google it. They're looking for an answer. And it might say, like, go get your thyroid checked. Okay, so you go get your thyroid checked, and there's that curve, and it kind of lands maybe on this lower side. And then the phone call back to you sounds something like this. Hey, Grant, we got your blood test back. Looks to us like you're in the normal range. That's what you're being told. But you're saying, well, I don't feel normal. What is it? There's got to be something else. And their answer is, well, you know, maybe you're just getting older or something. They don't really have a good answer for you. So we don't do that. What we do is we treat that value and put it over to this side of the curve. We're still in the reference range, but we're moving it over here, resetting it where it once was 5, 10, 15, 20, 30 years ago when you were at the season of your life and you felt your best. So what happened over time is it just drifted down, so it created the symptoms. So when I move that over there, we call that what? Optimization. Following me? All right, so if you still feel sick but your labs are, quote, normal, you're probably not optimal. We want to put it back to where it belongs, where it once was. So hormones are basically a lock and key kind of thing. So the question is, do we lose our hormones because we age? See, I don't think so. I think it's the other way around. I think we age because we lose our hormones. The aging process accelerates because the hormones are no longer there to function in the way that they once were. That's the key. So people that aren't optimized, you might feel like this but are told that your labs are normal, all right? Or if they're optimal, they look like this. Or maybe they're like this when they're not optimal, and then when they're finally optimized, they look like this, okay? Or maybe they're like this. Let's see here if we can play this.
Jersey writes in and says, Dear Rosanna Dana, last Thursday I quit smoking. Now I'm depressed, I gained weight, my face broke out, I'm nauseous, I'm constipated, my feet swelled, my gums are bleeding, my sinuses are clogged, I got heartburn, I'm cranky, and I have gas. What should I do? Mr. Fader, you sound like a real attractive guy.
I just think his hormones are out of whack. I mean, I think that's the root cause. To me, it's simple, yeah. Yeah. So here's the list. I'm not going to read it all to you, but if you'll just take a look here, it's like, go down through this list here and say, do I know anybody that has that? Now, no elbowing tonight in the crowd. Don't be elbowing anybody. But if you know people that have those, or maybe something yourself, you don't have to panic. It's fixable. It's reversible. And it's simply just a hormonal deficiency. So I like to ask the question about fatigue. So what do people do here in Leavenworth when you're tired? If you're tired and you need to treat your tiredness or your fatigue, what do? What's everybody do usually? Coffee. Grab a cup of coffee. Okay, anything else? Energy drinks, right? You guys sell energy drinks up here? Okay, different kinds. By the way, what do those things run? Any idea? $5 a piece, right? So, yep. So, I have a patient that I asked the guy last week, I said, hey, do you ever drink any energy drinks? He goes, oh yeah, I take one every day at 3:45. I'm like, why is that? He goes, 'cause after drinking it, I know that I have enough energy to finish my shift, drive home through the traffic, and get home before the crash hits. Because he knows that when you borrow energy from the future, you have to pay it back. And he knows that crash is coming. He doesn't want that to happen when he's in traffic somewhere, right? So that's what he's thinking. So $5 a day. And so there's a symptom checklist, and we probably have one of those floating around here tonight. We'll be getting y'all some. It serves as what I call a before picture. Okay, so here, what we want to do here, we pay very close attention to people's symptoms. In fact, when we create a dose for somebody, 80% of the judgment to determine the dose is based on symptoms. 20% is the lab test, not the other way around. See, here we don't treat the blood test, we treat the patient. I just need the blood test to assist me a little bit. Are you following me? That's the philosophy, okay? So there it is. As the hormones start diving down, 20s, 30s, 40s, all this stuff shows up. But look what happens when you restore the hormones. You get into the blue area, things recover, sleep gets better, libido gets better, results in the gym gets better, the ability to lose weight gets better, all the stuff that we want. So that's the key behind optimization. So here's the methodology. What hormones does the BioT method balance out? It's easy, 4 things: testosterone, estrogen, thyroid, and vitamin D. And we incorporate some medical grade nutritionals to improve those results. So let's go through those. So let's talk about andropause. So this is men, male menopause. We can call it manopause if you want. 20% of males over 50 have it. Quite frankly, I think it's far higher than that, and that's by personal observation in my medical practice for 30-some years. It's way higher than that. Personally, I've noticed and witnessed that. It's very common in chronic illnesses: diabetes, blood pressure, cholesterol, sleep apnea, leads to all kinds of things. And so testosterone is the true underlying and major hormone there. So let's talk about the concept of the hormone testosterone, all right? It provides major symptom relief to brain, bones, heart, as well as relationships. It's present in both men and women. It's more the dominant hormone in men, less so the dominant hormone in women. It's large amounts of that. Men aged 30 to 70 lose 1 to 3% per year. Quite frankly, I think it's higher than that. And women start losing it 15 years before menopause, and it starts in the age 20-40, between 20 and 40, okay? So that's pretty important. When I have a guy come in to see me and he's reaching for the doorknob, he says, "Oh, by the way, doc, one more thing. Things aren't working as well in the bedroom as they used to. Do you have any of those little blue pills?" He might say. So I already know at that point that if he's got symptom here below the iceberg where 8/9 of the iceberg lies, he's got symptoms with blood pressure, cholesterol, inflammatory things, maybe even diabetes. That's the root cause of the issue. I don't just treat his little blue pill because that would be like a Band-Aid. I now know that he's got a root cause problem. And if I do that, I can actually help him avoid his first heart attack, which is likely to come in the next 7 years. So that's a functional medicine approach. Here's an important chart, probably one of the most important charts in the whole slide deck. You're welcome to take a picture of this if you want. It's a remarkable grouping of data. So it's serum or blood testosterone levels in young men, kind of like Grant up here, a young man. Should be 800, 900, maybe 1,000. And then what happens is it never ends up hitting that high, and we start losing 2 to 3% per year or more, beginning actually in our 20s. And as it drops down, us men, we accumulate weight around our midsection, our muscles soften, and we don't like it. And then when it drops below 900, we actually lose the protection for future Alzheimer's. In the 800s, we lose the protection for prostate cancer. In the 700s, we get metabolic. That's that weight we gain in the midsection. Down in the 400s, our energy's dropping, our libido's going down. 300s, cholesterol numbers are rising, heart disease. Down in the upper 200s, depression, anxiety, PTSD symptoms flare. And not till it gets clear down here to the low 230s do they have plumbing problems. That's the last thing to show up. So I've yet to meet the man that can adequately guess his testosterone levels, because he thinks if the plumbing works, he's all good. That's the last thing to leave. So us men, we not only we need our testosterone. We need it for our brains and our bones and our hearts, not just our relationships. So one of our therapies, the BioT therapy, puts us right up here at 1,000. Boom, we're off and running 4 to 5 months. In women, we just compress that chart way down to much lower levels that are appropriate for that gender, okay? So one question we get from time to time, hey, I once heard that if you give somebody who has prostate cancer testosterone, it's like throwing gas on a fire. Have y'all ever heard that anywhere in your training? Okay, we now know, and we've had known that for now 2 or 3 or more decades, that is completely myth and conjecture and urban legend. This is Dr. Morgentaler. He's the chair of urology at Harvard University, the world's leading authority on testosterone. He says there's 19 studies that says there is no increased risk in prostate cancer in men that are treated with testosterone therapy. He says the opposite is true. Multiple studies show that low testosterone is associated with high-grade prostate cancer. And at the time of presentation, they're actually more advanced. They have higher Gleason scores. So it's the opposite is true. Testosterone is protective for prostate cancer. So the positive effects of natural testosterone for both men and women are this. You heard Julie mention earlier, she says her energy's better. She doesn't get as tired in the afternoon. Improve overall feeling of well-being, relief from anxiety and depression, clearance of brain fog, improvement of libido and performance. And then on the cancer side of things, we're talking about protecting from breast cancer, prostate cancer, protecting brain and heart and bones, increasing muscle and strength, reducing body fat, lowering cholesterol. Those are the beneficial, positive things that people have when they optimize their testosterone levels. How about cholesterol levels? Look at this. I was impressed to learn that all the bad cholesterol numbers go down and the good cholesterol numbers go up over time. And again, this takes months, but there's no prescription drug I could write you that does all that. And any studies that show that there were are far overrated. All right, little peek into myself. This is a coronary calcium score. So this is my personal score. I went and laid under, and they found out, it's a rapid CT scan that measures any calcium buildup in my heart arteries. So I did it, and some of you in the front row can see this, but what does it say my total calcium score is? It says 0, and if you look deeper in the report, it says my coronary age is what? Less than 35. Now, I don't know if that means like 29 or 25, or I don't know what that means, but they say in Texas, it ain't bragging if you've done it. So my wife is the same thing, so I'm thankful for that, right? So, and I can call a lot of you in here, young man and young lady, more than you think I can, and so that's kind of cool. And so I sent this to a cardiologist friend of mine who does heart caths and all that. I said, hey, what do you think of this report? He goes, oh my God. He goes, you need to start smoking cigars and eating ice cream every night. You're just fine. So I said, oh, I don't think I want to do that. How about menopause? For ladies, guess what? 3,500 women enter menopause every day. Symptoms may be 15 years earlier. Women are more affected than they realize, and most of them don't really ever get over it. Okay, it's a problem that they have the rest of their life. Before menopause, they've lost testosterone, which is why their heart disease rate is 1 in 7. After they then finally also lose estrogen, because the ovaries shut down, their heart rate doubles, their heart attack rate doubles to that of men, and it becomes 1 in 3. So again, testosterone and estrogen are protective for the heart. Let's talk about estrogen. It's present in both men and women. Wait a minute, you mean men have estrogen? Yes. We have estrogen because it's part of the conversion of testosterone. We need a little bit of estrogen. We don't need a lot. We need a little bit. It's what makes us nice. We need some, right? It's the dominant hormone in women. Large amounts, has over 400 functions in the body, and when we give ladies back the estrogen that they've missed, they get control of their hot flashes, their skin brightens up, they have the happy hormone back, their bones start getting stronger, their muscles start getting stronger. We start protecting the brain from neurodegenerative diseases like Alzheimer's and dementias. Their cholesterol numbers improve, and we're protecting bone, breast, brain, and heart, also in concert with testosterone. So hormone therapy is a positive deal. It's a very good thing. We want to replace that which has been lost. So here's what's available in the market. There's synthetics, and then there's bioidentical. Synthetics are usually formulations, drugs produced by pharmaceutical companies that have their origin in usually animal urine or feces, okay? Doesn't sound very attractive, does it? But that's how they synthesize those. The bioidenticals is the same exact molecule that the ovary and the testicle produces, and it always has. And they're both available in different ways to get in your body. We call those delivery systems, okay? There's ways to get through the body because you can't necessarily take a pill all the time. So here was a study 20 years ago, Women's Health Initiative. Some of you may remember it. And you may remember back in the day we used to have magazines, right? And there was a Time magazine article that says, oh my gosh, don't hormones cause cancer? And this study was flawed. They made some inappropriate and some wrong conclusions, but the news got out. It said all these problems with stroke, heart attack, breast cancer, blood clots, Alzheimer's. And so everybody freaked out. The medical community freaked out. Everybody came off their hormones. And then we end up losing an entire generation of women because all the protective value of those hormones are wrong. They later republished the data, and they said, and it took them 10 to 15 years, they said, you know what, we were wrong, we're sorry, those were wrong information. In the meantime, all the damage has been done. Some of you have heard of this product called Prempro or Premarin. You ever heard of Premarin? Premarin is a word that's formed because its origin is from pregnant mare's urine, hence the term Premarin. Okay, an example of that. It's the progestin in it that's the problem. It's the synthetic progestin that created the problems. That's what created the cancers, the heart disease, the Alzheimer's, all the symptoms that are negative that you see on the right there. It was that synthetic progestin, which is very problematic. Okay, that's what causes all these. So you don't want that. So there's ways to get them into your system. There's patches. You've all seen people put the patches on. slap a patch right in there, slow time release over 3 days. The problem is the skin is designed to keep things out, not necessarily let things in. So 45% of the people don't absorb them properly. And when they do, they get a big spike and then it wears off. Okay? So creams and gels, this is really worse because these you have to apply twice a day. And if you rub it on here, then you pick up your dog or your baby, that can rub off on your dog or your baby or your pet. And then that individual or that person or that pet then gets those hormones. And that's not very helpful or desirable. Some people have heard of shots, you know, especially this is common in testosterone. Men's like to go out and do shots. They're synthetic. They actually raise liver enzymes. They raise cholesterol. It always wears off. You get a big spike. It lasts for a few days, and so it goes up. They feel great, and then it wears off, and then it seems that everybody around them can tell when it's time for their next shot before they can, because we get cranky. So that's not necessarily the best way. So that's where pellets kind of take the day. These are natural plant-derived compounds. The sterol ring is actually extracted from the soy plant. There's no soy in it, but we use the sterol cholesterol ring, and then we replicate it identically to that of the compound produced by the ovary and the testicle, hence the term human identical. Bio, meaning plant, identical. It lasts longer than any other treatments, 3 to 4 to perhaps even up to 6 months. Most widely studied form of it out there. A steady stream of hormones in your blood, individualized, customized dosing. We actually place it right under the skin. What we do is place a little numbing medicine, make a nick in the skin, place the pellet, put a Band-Aid over it. It doesn't even require a stitch. Very minimal discomfort. Most people don't even know it's there. And then what happens is blood flow goes by the pellet, the more hormone is released. We call that release based on cardiac output. So the more you work out and exercise, the higher levels you enjoy. Kind of like just how the ovary and the testicle work, right? We call that endocrine mimicry, creating back that which has been lost. So it's been around for 85 years, most widely studied form. It's across the globe on 5 continents. Here's like an example of an estrogen level, okay? So versus there's the pills. You take a pill, it wears off. So you take the pill again the next day. So it goes up and then it wears off and you repeat it the next day. Seesaw. There's the patch, lasts for 3 days and you got to put a new patch on. The green is the implant. It's just steady state the whole time. And then you get peaks on it if you have your body puts demand on you, so you need the higher peak. What's the method of therapy? Helps the body return to normal hormonal and physiologic balance. It's the best kind of hormone because it's bioidentical. It's the right kind of dosing because it's individualized, and it's the right delivery system because it's released slowly over time based on cardiac output, which is the pellet. So it's the safest and the most evidence-based out there, 75 years or more worth of experience. No roller coaster. You put it in a few times a year. Very low side effect profile. I'll show you what those are in a minute. It's the best method to increase bone density. No evidence whatsoever that it increased cancer risk. And in fact, I will tell you it's actually protective for breast cancer. And I'll show you a study that shows that. No increase in blood clots or heart attacks like the synthetics. And most studies that optimization is protective again to the brain, the bones, the heart. So let's take a look at those. Breast health. Okay, breast cancer studies. Testosterone delivered by pellet implant does not increase the risk. Okay, there's great data on that. It does not stimulate breast tissue. It's actually protective for breast cancer. Let me show you some data on that. And then the largest study ever released on breast cancer was, so there's been 2 of them now. And the largest one ever released was just published last April in a peer-reviewed journal. And this is, 10,000 patient years. And they show reduction in the occurrence and the incidence. That means the number of cases in breast cancer by up to 40%. Are you listening? 40%, not 5%, 40. It's enormous, okay? And they actually have the mechanisms all figured out. So that's wonderful. So people say, you know, one lady might come in, she goes, oh, you know, I don't know if I can take, you know, hormones because my mom had breast cancer. I heard that from time to time. And the answer is, not only can you, but you should, because it's the lack of hormones that led her down that pathway. So this is protective for you. We have plenty of data to show and validate that, which is remarkable. Bone health. When we give testosterone and estrogen back in a bioidentical way, we grow bone nearly 3 times the rate as the best bisphosphonates or prescription medicines. Some people have heard of like Fosamax, like drugs. So those are, this is the best way to grow that bone, and it grows the fastest. And we actually reverse osteoporosis in our clinic. Those of you who decide to do it as well, you'll follow the DEXA scans, and depending on how bad it is, you'll completely reverse all that safely, most effectively. Arthritic joints, testosterone is one of the most potent anti-inflammatories out there, and so you'll get relief from joint pains, and that's one of the key indicators. Some of my patients say, I can always tell when my pellets are wearing off, doc, because my knees start hurting again. So that's what brings them back. And we help, not to mention everything else that's happening in their body in a positive way because of the testosterone. So how about the brain health? Women get Alzheimer's 8 to 1. Women on estrogen are 50% less likely to develop Alzheimer's. Men with low T develop Alzheimer's at 3 times the rate because of low testosterone. How about the heart? Basically what you're going to see here is that the estrogen is protective, the testosterone is protective. Addition of testosterone does not negate the favorable effects of estrogen. Marked reduction in fat mass, especially in women, when they had the estrogen and testosterone. So women will actually lean up over 18 months because they'll help build muscle mass, further protecting their heart. So what also else is important? Thyroid. Thyroid is basically metabolism, hair, skin, and nails. So we reset your thyroid levels to where they should be when you were younger. Vitamin D is actually a pro-hormone, certainly protective for COVID, and we're all familiar with that now. You hear all these data out there of people that had bad reactions with COVID, all their diet vitamin D levels were extremely low, so that's actually an immune enhancer. And then women only get progesterone. That helps them relax at night so they get better sleep, again restoring that which the ovary has stopped making. So for those who want a better life, millions of patients who just don't want the old Band-Aid approach, but they want the health approach, the healing approach. It's evidence-based medicine, and again, it's a focus on healing, not just fixing and curing. So here's really kind of the next step. If you're experiencing some of these symptoms, or you know people who are, what I would say is just get your blood work done. It's easy. It's like putting the dipstick in the crankcase. You see what you got, okay? So Julie has some incredible value on getting blood tests done. That can be done tonight. Doesn't have to be done tonight. It can be done next week. She'll talk about it shortly, what that is. But that's what you want to do before you consider in therapy, is just get tested. Just see where your numbers are. They might surprise you as to how low, and then it'll all start clicking and realize maybe that's my reason why I have those symptoms. So there's your yearly treatment comparisons. If you're going to do shots done with men, by the way, in testosterone, done properly, should be twice weekly. Not once a week, not once every 2 weeks. Creams have to be applied twice a day, so that's 700 times a year. Pellets are 3 to 4, so it's very easy. This makes sense that it's a better way to go. Some potential temporary concerns of first insertion. So testosterone, the reason any potential side effects might happen is because the hormones work. They get absorbed. So testosterone makes the kidney work better. The kidney's job is to absorb sodium. When sodium goes, sometimes you get some temporary fluid restriction. Everything I list here is temporary and it's mild, all right? Bless you. So the fluid retention is here. That's what happened to me. So I got a little bit puffy when I first used it. I noticed my face was a little puffy, so what did I do? I took a diuretic for 30 days. It got rid of it. It's never come back since. And I've had 15 pellet insertions over 5 years, okay? So swelling of the hands and feet can happen. It doesn't mean it will happen. I mean, it can, but it's mild. The breast tissue, if it's not seen estrogen in a number of years, kind of wakes up. So sometimes that temporary tenderness will happen. We give you evening primrose oils capsule, and it gets rid of it. It's no big deal. Uterine spotting can show up, all right? The pellets don't cause problems. They uncover problems. That's why we'll oftentimes detect a fibroid or a polyp or something like that. We simply remove it. Mood swings can happen temporarily for a few days. If you don't honor the temporary restrictions we put on you, you could actually pop out a pellet. It doesn't hurt. It sounds weird, though. It sounds like you're a Pez dispenser or something, you know. You're really not. It just kind of comes out and you just take it out, no big deal. Men can experience a temporary reduction in the size of the testicle or the sperm count because that part of the volume that's due to the swimmers is temporarily suppressed. So we give you a compound called DIM to help alleviate that. And when the therapy wears off, it goes right back to the size it was. See, again, all temporary, nothing permanent. So the key facts are hormone insufficiencies, imbalance can happen at any age. Not all therapies are created equal. It is not a one-size-fits-all approach. You need somebody who knows what they're doing, who's trained properly. And low normal labs may not be optimal. So again, it prods you to kind of get the test done. So let me just share with you, I've just got a few of my patients send me pictures. It's crazy. I don't ask for them, they just send them to me. So some of these are very interesting, but they all report an increase in mood and energy, increased drive, increased consistency in their moods, relief from anxiety and depression. That is a big one, especially in younger males when they have anxiety. I can't, it's just remarkable to me, but I used to see guys in the ER, they would think they were having a panic attack, or they were thinking of having chest pain. They'd show up convinced they're having a heart attack. They're 25, you run all the tests, you send them home, you give them anti-anxiety pills, but they don't have heart attacks, right? So they end up seeing me in the clinic, and I check their testosterone levels. They're 250 and 300. I've got 50-year-old men with numbers higher than them. You restore their testosterone, their anxiety goes away. See, they don't have a Xanax deficiency or a Zoloft deficiency, they have a testosterone deficiency. So that's, again, a focus on the healing. So better capacity to get in shape. These are just texts that some of my patients sent me. It's been 3 weeks since my pellets. I got to tell you, it's been a game changer. My anxiety is gone. I sleep better. I got more present with my kids. My work is better than ever. Thank you. He even spelled my name wrong. I don't care. That's fine. You know, I'm getting back in the gym. You know, unbelievable. So let me share with you a little video clip I think you'll find helpful. Okay, here we go, right here. And start.
Some of the symptoms that I was experiencing were some hot flashes during the day, night sweats.
I was tired all the time. Low libido, just kind of felt like I was a slug.
I wasn't even interested in intimacy with my husband.
My moods were horrible.
Fatigue, lack of energy, not sleeping well at night.
I was grumpy all the time. I just had no joy.
Low energy level, sometimes confusion, just not thinking real clear early in the mornings.
I didn't feel like I was myself. I thought it was just part of growing old, aging process. I didn't realize that my hormones could be out of whack.
They tested me for pituitary tumors and all kinds of things, and I asked, can you just check my hormones? And that's when they found out that I wasn't making any estrogen.
I had a friend who told me about BioT and what it did for her, and then I was hearing these ads on KOA and other radio stations promoting BioT Medical, and it all sort of converged at the perfect time for me.
I loved the idea that it was natural. I loved the idea that it wasn't something I had to remember to rub on my skin or take orally or whatever I needed to do.
I tried every hormone under the sun before BioT.
Being in radio, it's stressful. There's always things happening. You've got to be reacting really quickly. And for me, for a while, that was kind of difficult. And then I figured out, okay, it's my hormone imbalance. We got that corrected with BioT. And since then, I feel like I'm raring to go every day.
I found really the results to be pretty immediate. And I think even some of the things I wasn't even aware of, I found a little bit more mental clarity. I didn't realize I was foggy until the fog kind of cleared.
I finally just looked back after a few days once they kicked in and thought I really feel good and I feel like I want to run. And I've never in my life ran. I'm a type 2 diabetic, and since I've been pelleted, I've been able to come off one of my 2 diabetic medications. I've stopped using my antidepressant drug that I've been on for years. And I've also been able to get off of my cholesterol lowering medication.
First thing I noticed for me when I knew something was different was I was doing the dishes at about 8 o'clock at night one night. And my wife looked at me and said, "Why are you doing the dishes?" And I said, "I don't know. I just can't stop doing them. I just feel like I can get stuff done."
I was excited to be able to keep up with my kids and my family and the life that I love.
I feel confident and I feel excited about living.
Being able to just be spontaneous again has been just a huge asset to our marriage.
It just feels like I'm a newlywed again.
At the beginning of the program, I was engaged, but now I'm married, and my husband even tells me that he didn't realize that it could get better. But I feel like I'm able to give him a better of myself that I didn't even know that was missing.
Now, my husband is pleased that my libido has come back, that I've got my energy, and my kiddo is thrilled that I can run around with him.
teachers and dean of students that ask me, you know, Lisa Ann, what are you doing? And it's BioT.
I recommend BioT to everybody who talks about hormones, who's out there wondering what's wrong with them. Go for the optimized levels, and the way to do that is go to biotmedical.com like I did.
I would like to thank BioT for changing my life.
For helping me to get my life back.
For giving me a portion of my life back that I didn't even know I had lost.
For what it's given me back, a healthier, happier life, more energy. My husband has his wife back, my kids have their mom back.
I want to thank BioT for helping me age healthier and live happier over the next several years of my life. I'm really excited about what's to come.
The video's a few seconds off, but sorry about that. You can all get that, so just roll through some of this stuff. Okay. Yes, so there's a few key nutraceuticals that go with it. So those are things that make the pellets last longer and work better, restore your immune system, that kind of thing. So I'll tell you what, why don't we, let me just take a minute here and answer any basic general questions. If you have a personal, private, medical question, let's not answer it in the public format. Come up to me off to the side. Otherwise, if you have a general question that you think either the listeners on the video or somebody, you know, that might also in the room want to benefit from, now would be the time to ask that, and then I'll field the questions, and then we'll just kind of end the presentation.